We are going to talk a little bit about yearly treatment planning with an emphasis on summer safe treatments today. Of course, for those who don't know me, I am Lisa Ishii. I'm a board-certified dermatologist and a cosmetic and laser fellowship-trained dermatologic surgeon. I'm really excited about this talk because a lot of my patients have been coming in asking specifically about what can I do over the summer to continue to maintain and build on my goals. So I was really happy to make this talk because I think it's going to be really, really helpful as we go into the hotter months. So this is our agenda today, but we will jump right into it. So in terms of consultation, if you have ever done a consultation with me, I'm a huge fan of a 360-degree assessment. This means I am looking at you holistically and I am planning for you long-term. So this doesn't mean that we're filling lines here and there. I'm actually looking holistically at your skin, hair, body concerns and saying, okay, how can we have you reach your goals over the long term so you can look your very best moving forward? So typically I actually have a few different consultations throughout the year so we can kind of focus on different areas and different goals of yours. But typically we can talk about the face, the neck, the body, and even hair. And of course, we hone in on each of these areas to make sure that we are targeting the main concern of each area. So things like tone, texture, and volume loss. What a lot of people don't realize though is for me, all of the stuff that we do in our office is for fun, right? It is at the end of the day elective. So I want to make sure that everything that we're selecting and doing for you to reach your goals are going to be something that takes your lifestyle into consideration. Okay, this is really, really important to me. And I want you guys to be honest with me as well, because this helps me plan around the year, plan for things that are coming up. And as we, importantly, as we get into spring and summer, a lot more things kind of ramp up. We get a little bit busier, right? We're traveling more, spring break comes up, or summer trips. Our children's baseball and soccer games start to ramp up. So we're spending a little bit more time outside. We're doing a lot more gardening. A lot of us like to play outdoor sports like tennis and golf, and we're doing a lot more of these things. So I want to make sure that the stuff that we're doing for you in the summer is taking this stuff into account. So I want to take a step back and talk to you guys really what I mean by summer safe treatments. And I'm going to put summer safe in quotes, and quotes is important because I'll get to this in a second. Everything we do is technically summer safe with the right precautions, okay? But what do we really mean by, quote, summer safe treatments? This means that the treatment that we do, even if there's a little bit of tan on the skin, even if we have a little extra sun exposure on the skin, this treatment is safe and we can recover from the treatment without an issue, okay? Now, what does it mean when our body actually gets a tan? So this is important because by the time you see that first sign of tan, that is actually your skin's mayday sign that it has sustained UV damage already. So our body feels that UV damage, and then we actually start signaling to get our melanin production up so we can protect our skin against further UV damage. So there's no such thing as a safe tan. There's no such thing as a base tan, unfortunately. It just means that we have UV damage. Now, when our skin has this extra UV damage and extra melanin in the skin, we are going to be at a higher risk of having pigment-related issues when it comes to our lasers and energy-based devices. So you guys have probably heard about something called post-inflammatory hyperpigmentation. The best example that I like to give is, for instance, if I were to get a mosquito bite or I get like a pimple and I pick at it, like I know I'm not supposed to, but I pick at it anyway, and that red inflamed tissue goes down, even after that redness and the inflammation fades, sometimes it leaves behind like a shadow of like darkness, a little bit of hyperpigmentation. And that is post-inflammatory hyperpigmentation. Anything that induces inflammation onto the skin, this can mean inflammation caused by our procedures, you are at a higher risk of post-inflammatory hyperpigmentation, especially when our skin is already primed to produce a little bit of melanin. In addition, if we are doing a laser or a light-based device that is specifically trying to target pigment and we already have a little extra tan or pigment in our skin, sometimes the laser or light can react a little too much with the skin. and the procedure and the results can be unpredictable. In addition, you want to make sure that we're actually targeting the browns and the pigment that we want to target, not this extra pigment in the skin. Like I said earlier, there's no such thing as a good tan. All tans are bad, period. I say this out of love. And this is important because this is embarrassing, but this is actually me on a beach. This is a candid photo that my friends took while we were on a friend's trip here. And my marketing director highly encouraged me to put this on there because I understand that not everyone and not all of you guys are looking like this on the beach. And that's totally okay. Because this is what I'm saying when I'm telling you to be honest with me. Tell me what your trips are. Tell me what your plans are. Tell me how realistically you can hide from the sun. So when I'm thinking about your treatment planning, I can plan for you and I can tailor that treatment plan for you. So let's kind of circle back. What about lasers and light-based devices? Can I get those in the summer? So again, technically, yes. But unless you're looking like me at the beach and you have a beach vacation coming up, you do not get to do it because that is not the best treatment option for you. I have other treatments that I can offer you that can target similar concerns a little bit more safely. So I want to take a step back and break it a little bit down by the goals that you guys have asked me about. So let's talk about skin texture first. So a lot of different things can target skin texture, but I think it's always easier to see photos rather than me kind of give you a list. I'm going to give you a couple examples here. So this beautiful patient has been getting hydrofacials and been using medical grade skincare religiously at home. And you can see just how much better her skin texture and skin quality looks. So when I talk about skin texture and skin quality, I am thinking about things like roughness, how the light reflects off the skin, how luminous your skin is or how radiant your skin is. We can kind of address things like little bumps and lumps here. But overall, when we talk about improved skin texture, skin quality, I really look for light reflection because that is going to show how well the skin and how healthy the skin is able to reflect the light. Okay, so in this person's case, you can immediately see that beautiful light reflection. You can see that the skin is a lot less dull. It's a little bit more radiant. It looks a little bit more supple. And this was just with hydrofacials and medical grade skincare. So like I said, you don't have to do the heavy duty stuff over the summer if you have all these plans coming up. Be consistent with the stuff that you're already doing at home, and then bring in some procedures that you might feel more comfortable doing over your busier months. So this patient, similarly, she underwent skin pen microneedling. Again, look at the light reflection, right? The skin just looks so much more radiant. I hope you guys can see my little pointer here, maybe here. But over the lower face, kind of at the corners of the mouth, you can see that she has some very mild acne scars, and those are also a lot softer post-treatment. And finally here, so injectable treatments are always going to be summer safe, and it's because we're not causing all this inflammation on the skin surface. We're kind of going underneath to the target tissue to getting our effect. So this is a patient that was noticing some age-related changes, but also some acne scarring from long past over the lower face. And with some hyaluronic acid gel-based filler and neuromodulator, you can see just how smooth and just how supple that skin looks. So I can't talk about skin quality and skin texture without talking about volume loss and facial balancing, or more importantly, the umbrella term, which is facial architecture. If you guys are a patient of mine, you know how important it is for your facial architecture and your facial skin quality to be in congruency. So you want that to match. You don't want one thing to be way better than the other because then you don't have a holistic result. You don't look as healthful or useful or even natural. So when I talk about facial architecture, I'm going to be reaching for my hyaluronic acid gel-based fillers, my biostimulators like Sculptra, Radiesse, and even something like Kybella, which is an injectable deoxycholic acid that can help diminish fatty tissues, say like under the double chin. Okay, I typically use a combination of injectables to get you to your goal. So hyaluronic acid gel-based filler. So this patient came to me and she said, you know what? I like what I look like, but when I see myself from the side, I like it a little less. I want to feel a little bit more confident from the profile. So when I assessed her, we noticed that she has a beautiful cheekbone. She has a nice jawline, but you're noticing that her chin on the left-hand side is a little bit more recessed. When you see that chin recession, it makes us look a little less sharp along the jawline. So I did a syringe of hyaluronic acid gel-based filler to the chin so we can restore that nice sharpness to the jawline and restore that projection of the chin. And you can see that beautiful result there. We also actually did a little bit of neuromodulator to the muscle of the chin because she was noticing like the golf ball appearance or even like the orange peel appearance of the chin, and that is a muscular issue. So we actually did a little bit of neuromodulator to the chin to help relax that muscle down so it's nice and smooth as well. Hyaluronic acid gel-based filler over the years. So this patient was someone that wanted to avoid surgery. So over the years between 2019 and 2024, Dr. Cox kind of rebuilt some of her bony structure and fatty structure. And when filler is done well, it should be undetectable. This is a key pillar of our office. I think it's really important because you don't want to look done. You don't want to look fake. You just want to look like a refreshed version of yourself. And you can tell here that she looks exactly that, a refreshed version of herself. And here, so this patient underwent a combination treatment. We did some Kybella to help diminish the fatty tissue under the chin. Here you can see that that looks a little bit tauter, a little bit more balanced. We did a little bit of hyaluronic acid gel-based filler to help with chin projection. And of course, she had a little bit of that pebbly look. So we did a little bit of neuromodulator to help soften out that chin. And you can tell that she just looks so much more balanced. So let's switch gears and talk a little bit more about what we can do for body treatment. So I am always in conversations with my plastic surgery colleagues to make sure we are giving our patients the best results that we possibly can. A lot of patients notice that their skin over their body, neck even, starts to get a little bit crepey, or a little less taut looking, a little less supple looking, looks almost like tissue paper. So we can do things that help firm the skin and help tighten the skin, as well as contour smaller pockets of fat. So this is a patient of mine. She's fantastic. She dances internationally, and she was noticing that some of her dance uniforms she wasn't feeling confident in because her skin was looking a little bit crepey. So we ended up doing a little bit of Sculptra. We did 5 sessions over the abdomen, and you can see just how much better quality that skin is. You can see that that crinkly stuff, especially above the belly button that we all tend to get, is a lot softer. You can tell that this crepey, tissue papery stuff over the lower abdomen looks so much more supple. I think these are kind of great ways that we can do to enhance what our body skin looks like. Another great example here. So this patient underwent 2 pregnancies, and she was noticing a crepey texture around her abdomen, again, above the belly button. That's where we all see it. So we did 2 sessions of Radiesse, and you can see just how much better and more supple that skin looks, less crinkly. And of course, I can't do this talk without talking about soft wave, my absolute favorite procedure. That's actually my summer plan for this June. But we kind of worked on this person's lower face and neck area. We picked up some of that crepey stuff there. And of course, we did a little bit of neuromodulator to that neck band so we can soften it out so it doesn't travel all the way down. And this patient is a very, very fit person, but she had that little stubborn pocket of fat right here on the lower abdomen. So we did a combination of Cool Sculpt and M-Sculpt to diminish that tiny fatty pocket and then tone the muscle on top. So you can see that she just looks a little bit more contoured here with that result. And the hair. So a lot of people forget that us dermatologists, we're expert on hair, skin, and nails, not just the skin. But hair health is important too. You want to look youthful over the face, you want to look youthful over the body, but you can't be having that hair give you away. So we have a few different ways to kind of target hair concerns. We can grow hair, we can maintain hair, but we can also diminish hair in areas that we don't want it. So this was a patient that underwent PRP, or platelet-rich plasma. This is an injectable treatment. So again, you always know that that's summer safe, kind of over the scalp, and you can see just how much denser that part is. The part is thinner. It's not kind of wide. We call this like the cookie or the Christmas tree kind of look, where it looks all wide here. But you can tell that now the part is nice and slim. You can also see that she's getting those tiny little exciting baby hairs in the temporal scalp, which we tend to lose hair. Now, of course, I don't have good before and after photos of sweat reduction. That's really hard to capture. But for sweat reduction, we have a couple modalities as well. We can do neuromodulators. This is always a slam dunk, especially for underarms. We can do it on hands and feet. In the neuromodulator, it actually can temporarily block the chemical signal to the nerve that stimulates sweat glands. So it can give you some nice long longevity without any sweating. We also have MiraDry, which is a device-based underarm sweat reduction. This can be done on underarm only. And finally, I want to wrap up with skin tone. And you notice that a lot of the skin tone things have a little asterisk or a star next to them. I do that on purpose because skin tone is tricky, okay? Because if we have a little bit more tan on the skin, we are already affecting the skin tone. So when we start to work on skin tone over the summer, we have to be careful because we want to make sure, number one, it is skin tone changes that you're seeing throughout the year. It's not just something that comes up in the summer. But also, because we might be affecting and targeting some of the pigment, right, melanin in the skin, we want to make sure that there's zero to no extra melanin in the skin. Now, of course, skin tone doesn't mean just brown. Sometimes we have red, sometimes we have purple. So we can target all of that as well. So V-beam. V-beam is one of my favorite lasers to do because it is so satisfying. It is a slam dunk for red things. So that could mean like those little cherry red moles. It could mean the broken capillaries around the nose. In this person's case, he had keratosis pilaris rubra. A lot of people have this, and a lot of people have this from childhood. But you have that kind of flushed red look over the cheeks. And this is with 6 sessions. We got that red flushing down so much that he's noticing that when he kind of overheats or exercising, he just doesn't have that bright red look anymore. And speaking of vascular lasers, you can also target deeper vessels with something called the gentle YAG laser. So this patient has that kind of ropey reticular vein around the eye. This is really common too, and we tend to get this. It makes our eyes look, sometimes can make it a little bit darker around or even more sunken looking. And with two treatments here, you can see that we actually made the vessel disappear. And yes, of course, pigment. So this patient underwent skin pen microneedling with device-assisted drug delivery of tranexamic acid. Tranexamic acid is a product that has been shown to diminish your body's ability to produce extra melanin, okay? So by kind of drizzling this stuff into the skin, we can actually calm down your skin's ability to produce that extra problem melanin. So after you do all of these amazing things over the spring and summertime, you got to protect your investment. And I have a few key takeaways. A lot of these are pretty obvious: sun avoidance, sun protection, compliance with prescription aftercare if indicated. But remember, I think the key important thing that I want to emphasize today is timing is everything. So, I want to be able to have you enjoy your vacations. I want you to be able to engage in your livelihood, like your tennis tournaments and your golf tournaments, and enjoy your kids' spring breaks and stuff. So be honest with me. Let's talk about it, because I think it's important to kind of weave around these obligations so that you can enjoy both the benefits of the treatment, but of course your livelihood. And I think the key and most important thing is you have to know thyself. Because if summer is your livelihood and you're like, I'm gonna be on the golf course golfing every single day, then you know what? None of these laser procedures is probably gonna be the right fit for you. And we might as well wait until the fall and winter where we can actually do more, like clear up that sun damage, reset your skin, so that when we go into the spring again, you're starting on a fresh. What to do next? As always, book a consultation with our team or myself. Let's chat. I think, again, the biggest and most important thing is an honest and open conversation about what events are coming up so we can kind of come up with a, again, long-term plan to make sure that we can get you to your goals and meet your needs. But that is it, friends. I am going to pop into the chat if I can figure it out so we can answer some questions here. Perfect. So a patient here is asking, what about being melasma prone in the summer? Excellent question. I'm actually really happy that you brought this up. So in terms of melasma is tricky because it is something that is flared by heat and by sun. So it's not just sun. A lot of people forget that. Heat can flare it. In fact, some people notice that they go to hot yoga and their melasma flares, and they're going to hot yoga in like the middle of winter. So with melasma, I am a lot more cautious. Okay, so I typically do not offer melasma pigmentary treatment over the summertime. Typically, I am into more melasma protection mode. I am hitting you heavy with the hydroquinone, which is a prescription strength brightening agent to help calm down the melanin producing cells so we're not flaring quite as much. We know your melasma is going to flare over the spring and summer. I am aware of that. So my goal is to make it flare as little as possible. So when we do get into fall and winter, we can plan accordingly and do some laser work without having to kind of undo the damage quite as much. Oh, someone said beautiful filler results. Thank you. Thank you. That's so kind. Another question here. Are there any skincare products we have to avoid in the summer? Also, these are such good questions. Good question. So again, technically, no. So there are some products that are going to make you a little bit more, quote, sun sensitive. So something like the retinoid that you're using every single day that you don't really think about, it's like brushing your teeth, right? You put it on and you don't think about it. That is going to make you a little bit more sun sensitive. That doesn't mean you have to stop your retinoid. It just means that you have to be a little bit more cognizant when you're out in the sun. So, even if you're just going to pop out to lunch with the girls and you're going to be sitting al fresco, you might want to put on some sunscreen or wear a hat, or even consider sitting in the shade instead of just letting your face just fry with your retinoid on top. Same thing with like exfoliating acids, so like glycolic acids, AHA, BHAs, things like that you might even be using at home. Again, it just makes your skin a little bit more sun sensitive, so you just have to be careful. But that is it, you guys. Thank you for listening. Let's stay in touch. This is our Aesthetic Solution Instagram and my Instagram as well. So feel free to reach out to me with questions.